GOLD participants from around the world. I'm Fleur Bickford, Program Director and MC for GOLD Learning. I'm chatting today with Debbie Fraser about her upcoming presentation for GOLD Perinatal 2016 titled Late Preterm Infants, Not as Grown Up as They Look. So, Debbie, thank you so much for being with us today.
Thank you again for inviting me to be part of this exciting venture.
Well, we are certainly thrilled to have you with us. Now, to start with, I'm going to reference something we were actually talking about in your other interview because you are doing two presentations for us, which is very exciting. So for our delegates, make sure that you listen to Debbie's other interview about intrauterine infections. And we were talking a little bit about the fact that you've worked in the NICU for a lot of years, and you mentioned that you've seen the pendulum swing several times in the NICU. And I'm wondering, what has changed most over the years when it comes to care in the NICU?
You know, it's hard to answer that question because there are so many things. I think the environment that you would have seen if you walked into the nursery even 15 years ago is so much different than today. And I think of things around the use of oxygen, the technologies for ventilation, but I also think about the small things, the way in which we feed babies, the fact that we now have babies at 28 weeks that can go to breast and can practice breastfeeding. And most of all, I think the way in which we engage with parents and families and how we're now beginning to see parents giving care in the NICU and nurses being coaches instead of care providers. So just a totally different environment than the high-tech, high-noise, bright lights, stressful unit that you would have been in 15 or 20 years ago in the nursery. So I think just huge changes that are very, very positive.
Absolutely. I think it's fantastic. You know, I don't work in the NICU, but just seeing all of the, the research and certainly aware of a lot of the changes that have been taking place. And it is really exciting to see that change towards more family-centered care in the NICU. And I think that there's a lot of really positive benefits for both the babies and the parents as they, are adjusting to parenthood in a very difficult place.
Absolutely, yeah.
So you're going to be talking in this presentation about late preterm infants. And I know late preterm infants are often called the great pretenders because they, as you say in your title, they definitely are not as grown up as they look. So I'm wondering, what do you feel are some of the biggest myths surrounding late preterm infants?
Well, I think one of the things we struggle with, as I alluded to in the title, is not knowing what to expect from these babies. And that's both on the part of parents as well as care providers. So we expect, because these babies look healthy, that they should be able to behave in a way that you would expect from a term infant, especially around feeding, but around other aspects of their care as well. And I think that's really the biggest concern we have, is trying to push these babies along a term infant continuum, rather than respecting some of the growing and maturing that they still have to do.
Okay, thank you for that. So perhaps just tell us a little bit about what do you hope delegates will be able to take away from your presentation and take back with them to their own practices?
I think the really important thing is that we have a plan for providing care for these babies. And people often ask me, should this baby be in NICU? Should this baby be in a special care unit? Can this baby be with mom? And the answer is, it really depends on whether or not we have the system in place to support the baby wherever they are. So I think for care providers, regardless of whether they work in a mother-baby unit, whether they work in a labor and delivery unit or in an intensive care unit, is that they have a plan in place to monitor these babies for those complications and understand how we can both prevent and address complications so that we can support these babies and their families.
Okay, thank you for that. And I know that you're going to be addressing all of that in your presentation. So we are really looking forward to that and looking forward to learning more from you. For our delegates who are listening, you'll be able to learn more from Debbie on Tuesday, October 25th at 1700 UTC. So be sure to check out the perinatal goldperinatal.com website for all of the details. And we look forward to seeing you then. Thanks everyone for joining, and bye for now.